Hi, I'm Dr. Rob Myers, and this is Cardio Talks. I'm a cardiologist at Sunnybrook Hospital in Toronto. Palpitations, you can feel your heartbeat. Incredibly anxiety-provoking symptom. Is it going to kill you? The answer is very unlikely. Like, so unlikely that feeling your heartbeat is actually going to result in death. More often, it'll result in such anxiety and stress that you'll come to see me. So palpitations are a symptom. They're not a sign, they're a symptom. In medicine, a symptom means this is what the patient complains of. A sign is what we find. So for example, a headache is a symptom. A brain tumor is a sign. And in the same way that overwhelmingly most headaches are not associated with any pathology, overwhelmingly palpitations are not associated with anything severe. Now they can be. There are certainly rhythm problems that can arise or be diagnosed with palpitations, but for the most part, palpitations do not correspond to anything critical. Now, I've done a series of videos on atrial fibrillation, and obviously palpitations can cause that annoying rhythm. So what is it about palpitations that disturbs people so much? It's a sudden feeling of your heart beating. I wouldn't want it. Why would you want it? So palpitations can be quite varied. In other words, palpitations can be just, what was that? Or palpitations can be, and then you fall down and lose consciousness. There's quite a wide range. So what are the red flags that I look for when I talk to a patient? And I talk to a lot of patients with palpitations, easily more than a dozen a week, every week for 30 years. These are the red flags, and these are all of them together. You obviously don't have to have all of them. The red flags that suggest to me that you actually have a rhythm problem I need to diagnose are sudden onset. It's like you're doing nothing but, let's say, watching a video on palpitations, you're eating, you're at home, and then suddenly, out of the blue, your heart beats very, very fast. You can feel it in your neck. Feels like you're running, but you're not. And it's not 2 seconds, 5 seconds, 4 seconds. It continues on. How long? It depends. It could be a minute, and that could be alarming. It could be longer. It could be associated with some lightheadedness, like, geez, I better go lie down. I don't want to go to the emergency department. Should I go to the hospital? Who do I call? And then, just as quickly, like a light switch, it stops. So when there's a sudden onset and sudden offset of a rapid beat with lightheadedness, that is suggesting to me strongly that the patient I'm speaking with has an actual rhythm problem I need to diligently look for. Not that I'm not diligently looking for anything else. The flip side of that is just that skipped beat. When patients are just like, oh, I've got my head on the pillow and I can feel my heartbeat, get your head off the pillow. It's just not relevant, really. A lot of people will feel their palpitations at night when they're benign. Why is that? Because nothing else is happening. You're in bed, the lights are off, it's dark, you're trying to get to sleep, and there's nothing external that is really bothering you. So one thing that you could benefit from is learning how to check your pulse. Now, a pulse can be checked really easily. You can check the arteries up here, which are like pencils that go up and down. They're called the carotids. Now, I don't use my thumb. I just use a few fingers. Most people don't get in there enough, and you can go in there and you can feel your heart beating. The other way to do it is your radial pulse on your wrist. Same idea. I use multiple fingers. Play with it a little bit and you'll know what I mean, and you can feel your heart beating, and you can get a sense of your heart rate, which is actually critically important. If you feel your heart regularly skipping a beat, that's probably exactly what it's doing. If it's irregular, you probably have atrial fibrillation. Now, what is really ineffective in my world are watches. It's what I call the watch consult, one of my least favorite consults. And the watch consult basically is a patient who feels perfectly well. They don't even have palpitations. They feel great, but their watch gives them a number they don't like. If you don't like it, I get it, but I have perhaps once in decades seen a patient where the watch alerts them to something that's accurate. Usually I'm reassuring people, yes, a heart rate of 45 in the middle of the night is normal. Or there's often watch consults from sort of a type A personality, usually middle-aged men or older. They're very active and aggressive, and they might come to me and say, you know, in the 28th kilometer of my Saturday morning bike routine, I noticed that on my Garmin, my heart rate's 160, and usually it's 152. That requires reassurance, and there's a fine line between reassuring somebody and dismissing somebody, so I try my best to reassure people. Now, this isn't 1930. Right? Somebody comes to see me with symptoms, I can assess, evaluate, and have a pretty good sense of the direction of whether I think it's an actual rhythm problem or not. But I'm not going to give you a mustard poultice, an ounce of whiskey, and take my horse and buggy to the next house. You need testing. Testing with palpitations is easy. It's always the same. When you're a hammer, everything's a nail, right? Testing is a heart rate monitor because the monitor picks up and records every single heartbeat while you're wearing it. It's called symptom rhythm correlation, and that's the challenge. If somebody has very infrequent symptoms, then the monitor, you may not be wearing it when the symptoms are present. So if somebody has an actual rhythm problem twice a year for an hour, unless you go to the hospital or get it checked out or use one of those devices that I think are actually pretty good at home, they can be good, not everybody should have one, then we're never going to identify the rhythm problem. I'm not going to be able to find it because what are the chances you're going to wear a monitor that one particular moment? If you're getting symptoms every single day, a 1 or 2 day Holter monitor, which you wear like a little purse, measures and records every single heartbeat, is very effective. If you get symptoms a few times a week or a few times a month, I'll use a 2-week monitor, a smaller waterproof device. It's a bit more annoying, you got to wear it for longer. And what am I looking for? I want you to have symptoms when you're wearing it. I know, you don't have control over that, and I don't have control over that. How many monitors we do when you don't have symptoms? Well, it depends on a lot of factors. But if you have symptoms while you're wearing the monitor, we have the answer. Now, overwhelmingly, in a younger person, the answer is ectopic or extra heartbeats. Older people too, but the older we are, 60s, 70s, 80s, the more likely palpitations will correspond to an actual rhythm problem like atrial fibrillation. But for the most part, most of the monitors I do are completely benign and I end up reassuring people. The features of a rhythm issue are going to be present more so in an older person with a history of heart disease, blood pressure, excess alcohol. In those men and women in their 40s and 50s, for example, and younger, lots of women in their 20s that I see, who feel their heart skipping and they're otherwise perfectly healthy people. They're not doing drugs, they're not doing coke, they're not drinking too much alcohol, they don't have any heart disease. Overwhelmingly, we don't find anything. Yes, we sometimes do, and it's annoying, but we can deal with it. It is so rare for palpitations to reflect something life-threatening. It's just, you need more reassurance than anything. The one test every patient has to have is an ultrasound of the heart, called an echocardiogram. In the same way that ultrasound is used to look at a baby, we look at the heart, we see the heart anatomically or structurally, and we can easily determine whether there's any associated heart problem with that sensation. So palpitations, for the most part, are extremely benign. I wish I could say always, but they usually are. And if you're falling into some of the categories that I'm talking about, hopefully that provides you some reassurance. And I hope that helps.